reports. I presume it's going to be Claire to start with, to briefly introduce the report, and I'll then call upon members who indicate they wish to speak by clicking on the raise hand icon in turn. Claire?
Yeah, thank you very much, Chair. So the report before you this morning is our annual corporate safeguarding report. It is for the year 23-24, but we do take the data up until September of this year. So it's a rolling year, and that's what we've done for this report for the last few years, actually. The report within our corporate safeguarding policy, we commit to an annual corporate safeguarding report, which comes here and then into Cabinet for approval. And it's different to other reports that we bring around safeguarding in that it is very much a report on all of the council and the responsibility and specific responsibilities of every directorate within the council around safeguarding. We have a corporate safeguarding group that I chair, but that it does have representatives of each directorate across the council. We've got a number of colleagues on the call this morning who've been very proactive in that group from across different directorates, namely Ryan Jones, who's on the screen, I can see now from a housing perspective, Kirsty Williams from a community safety partnership perspective. We have our lead officers for adult and children safeguarding here as well this morning, Rihanna Granger and Charlotte Pickin. So, you know, we should between us be able to answer most of the questions in terms of the report. What the report does is try and bring alive really that adage that safeguarding is everybody's business by being quite specific around what we mean in terms of that. So as you would expect, there's details in there around adult safeguarding, around safeguarding children. There's information in there around education safeguarding, around our workforce and how a safe workforce is the cornerstone really of any set of safeguarding arrangement. Housing, and we've talked a little bit about housing already this morning in terms of substance misuse and indeed, you know, areas that come under the community safety partnership. We've drawn out some specific areas of risk to us as an authority around placement sufficiency, out of area placement and the issue of operating without registration. And then the annual report itself, you know, just gives you a bit of detail in terms of areas where we've had a specific focus during the last year, areas that have been a particular risk, and we talk there about the eliminate profit. We've already talked about the secure estate this morning, but you know, you can see the read across there, the work we've done around corporate volunteering, workforce and you know, capacity and demand management. And we conclude the report by, you know, just setting out those areas for future focus. So if I just pause there, Chair, and obviously between myself and other officers, we hope to be able to answer questions from Scrutiny this morning.
Good, thanks. Any questions from councillors? Councillor Haynes.
Thank you, Chair. Yeah, a really interesting report, and again, my thanks to the authors of this. Another information-rich report, which was very illuminating. Got a number of questions, but I'll start with the first one, which is really related to page 34 of the report. On page 34, there is reference to an independent audit, which has been commissioned to look at numbers of children becoming looked after with future findings and actions to be identified and acted upon. So my question is, can further details be provided? Who actually is carrying out this independent audit? What are the terms of reference, for instance? When will they report and to whom? And who will be responsible for carrying out any recommendations, etc., that might arise from that? Got a number of other ones, but perhaps take them one at a time.
Yeah, I was going to say, I'll come back to you on the others. So we'll start with that one then. Thanks. About the audit, the whys, the wherefores, etc. Who's doing it, terms of reference, etc. So who's best to take that one then? Claire?
I'll take that one, Chair. I'm not 100% sure who is doing that independent audit, but we'll find out and we'll share the terms of reference with Scrutiny. I'm very happy to report back to Scrutiny around that as well. In terms of children looked after, care experienced children, as we call them in Bridgend, we are seeing an overall reduction in care experienced children numbers, and we are seeing that the numbers of children becoming looked after probably now is at the rate that we would expect it to be for the size of our population. The predominant, the majority or the highest sort of age range in terms of those becoming looked after are those between 10 and 15 and very little children, so under ones, and that would be quite common with many authorities. We're seeing an increase in those children ceasing to be looked after due to some very focused work in that area around discharge of care orders where it's safe to do so, and that's predominantly children who are accommodated with their own parents and a placement with parent orders from the court. The purpose of the audit will be to understand really whether there were any missed opportunities, particularly for those age in that 10 to 15 gap, whether if we'd acted preventatively sooner in that child's life and the family set of arrangements, whether we could have prevented what is, then at that age an inevitable coming into the care system. So I'll share the detailed terms of reference with Scrutiny and we'll confirm who's undertaking that audit.
Thanks. It's great that we've gone objective. You're taking the leap of faith, if you like. You've gone objective. Body, I presume, organisation coming in and look at that, and you'll share. Okay, Gary, is that all right? Yeah.
Yeah, it's it is. Thanks very much for that, and I would be interested in further information. I think, like we all would, but it sounds like a very professional approach. Thank you.
We'll continue with. Say something, Claire. Continue with the other questions you had.
Thank you, Chair. So if I go on to the next question, really, it is page 40, and it's related to item 5, workforce. It's a little concerning. I mean, have no need to be concerned, but I note that that there are compliance levels of compliance and non-compliance with DBS and safeguarding e-learning, given how critical these basic items are for the council, for everyone involved in the council. I'm a bit concerned that it doesn't appear to be any detail in terms of what levels of compliance and what levels of non-compliance there are. And for those who are non-compliant, what actions are being taken to ensure they become compliant? It seems to me to be important basic elements here, which I hope are not missing in any great extent. But I would be interested in learning what the actual figures are and what the follow-up actions are to put it right.
Can I just clarify? Are you talking about the first paragraph? Yeah, first paragraph in terms of a monthly update in the status of DBS checks and renewals, as well as quarterly data relating to completion rates for safeguarding training. Is that what you're talking about? Okay, so before I ask Claire to come back in, one of the things I think I'm concerned about looking at reports in other committees is the issue about non-compliance around the wider workforce, around basic training and in particular safeguarding training. So I don't know whether in future we need to ask for reports such as this for HR to come along as well and talk in some depth about it. First of all, I'll ask Claire if you want to come back on that, then Jane. Thanks.
Yeah, so to hopefully provide some assurance to committee, and we can amend this report and put some actual data in here because that would help, I think, in terms of when it goes through to cabinet. So we get a monthly safeguarding dashboard. HR fill out part of that dashboard, and the information they give is around compliance with the DBS policy. There will be very, very small numbers where we may, with a risk assessment, have appointed somebody without a DBS, but those will be always, less than 10. Everyone is risk assessed. Everyone in my directorate has to be agreed by myself, and it will always be a case where somebody won't be doing any regulated work until that DBS comes through, and they've already got a current DBS, but it might be with another employer. So there are checks and balances in that case. The new DBS policy that was approved by Cabinet took away the automatic renewal for employees of this council after 3 years, other than cases where individuals are registered with Social Care Wales, where DBS renewal at 3 years is required. So we still require that here. That brings us into common practice with other local authorities in Wales and with other organisations such as the Health Board. So whilst there might have been some level of concern, what we have to have confidence in is all those other checks, because the DBS is only ever a position at a moment in time. In terms of those renewals, again, we see data on that. There will be a very, very small number of individuals, often because they're off on sick leave or off on maternity leave, where the DBS isn't in place, and it's escalated to heads of service, and they take, I would say, a very, very robust approach around that. If somebody is in work and they haven't done what they need to do, either around registration or around DBS renewal, they will be risk assessed, and they will often then not be in work, and potentially subject to a disciplinary process as a consequence of that, because that is a requirement of their contract. In terms of the training issue, that data will come through. I think it'll be going to COSC in January now as part of the quarterly performance reports that we have. Across the council, probably compliance with essential e-learning for safeguarding training is higher than for other mandatory training areas, and we have strong oversight of that through our corporate safeguarding group. I would say probably the two directorates where we're not as high as other directorates happen to be mine and education, early years and young people. The explanation around that is that the individuals working in those directorates will have very high levels of safeguarding training that they have to comply and keep up to date over and above what is the mandatory e-learning. And I think we need to take a view as a council whether that e-learning therefore is essential for all of those staff. But that is what we monitor, and that's always the explanation that comes forward. What I would say is that compliance with essential e-learning for other areas which are relevant to safeguarding, such as the VAUDRA SV, is far less good across the piece, including in my directorate. So there are a range of actions that are in place in order to improve that position.
Thanks. So that skews the figures really then for your department, doesn't it? And there needs to be something inserted into the report in January stating that, because it's almost pointless asking staff to do mandatory safeguarding training, same mandatory safeguarding training as every other member of the council, when the in-person, not online, in-person training you do, because I think you get a Welsh Government grant, don't you, to pay for that in-person training, is of a much higher standard. So we're shooting ourselves in the foot, really, by allowing that kind of warped statistic to come to the fore, if you like. Yeah? Does that answer your question, Councillor Haynes?
Yeah, I find that far more reassuring than the potential picture that could have been painted there. Yes, thank you for the response, and I am somewhat reassured. Thank you.
Thank you very much, Chair. I was going to pick up on the point of PIs. I know it's been raised with Alex Rawlin, funnily enough. There is no point in social services staff, with the level of training that they have, completing an e-learning training that is sufficient for us as members, but is certainly not sufficient for them to discharge their function and duty. And I think it's important that we challenge that assumption. So that there are members here that are on governance and audit and corporate overview and scrutiny committee. That is something that I would ask that is raised significantly. It has been challenged previously, but it is something that we need to keep an eye on, because it definitely skews my officer's assessments.
Councillor Haynes, any other questions?
Yeah, I think you've heard almost enough from me, but I have one more question, if that's okay, Chair. It refers to page 47, paragraph 2. And I noticed earlier in the report new models of service provision and the positive impact of the front door teams, which is really encouraging to hear. It's also a little bit, given that statement, it's a little bit concerning to see that the adult services social work teams, front door teams, appear to be challenged in terms of staffing because of long-term sickness as well as vacant positions. So given the importance of this new model of service provision and its positive impact, I'd like to know how quickly this deficit in staffing at the front door service provision, how soon it can be alleviated, and we'll see an improvement. Thank you.
Jackie.
Thank you, and thank you for the question. So a couple of things really. We started a new operating model back in February of this year that did bring together quite a number of teams together and created our early intervention and prevention hub. What we saw in the summer was some work-related stress because of the sheer volume and the demand that was coming through the front door and the complexity of the individuals that were coming through the front door. As a senior management team, we worked alongside the whole of adult services in terms of managing that situation at the time. So very short-term arrangements were put in place. I can say as at today that it's a much improved position. People are back in work. But throughout that period where we had less resource in our front door, what I did do is deploy staff from other parts of the service so that our front door was covered. We had senior officers that were on the phones. They were dealing with the GP referrals. Quite a number of actions that we took in place of that. What I did do back towards in September was that I asked one of my other officers to do a deep dive into the situation to establish what the cause was and what our actions were going forward. We've concluded that deep dive. There is a formal action plan that's now going to be put in place, and I'm going to be chairing that on a monthly basis through like a project management board sort of arrangement, really. It is an improving position, but it is about some of the demand that's coming in the door that created some of that. And yeah, so I don't know when this is going to Cabinet. We might put a further update now about what we've done since into the report before it goes into the next stage. So I hope that answers your question.
Councillor Haynes.
Yes, it does. I'm glad that it's been addressed so promptly, because I think it's a vital element of this new model service provision and its efficiency and effectiveness. We want to maintain that. So it's good to hear that. Thank you.
Jackie, a couple more questions from members. It's Councillor Joanna Hopkins.
Thank you, Chair. I've got a couple of questions. The first one is regarding permanent exclusions from school. I want to know what's being done to prevent children getting to the point where they're permanently excluded. My next question then is regarding the home educated children. What safeguarding is put in place for them? My last question is on page 48. It says that they're trying to reduce access to means of suicide. Can you explain that, please? Thank you.
I will do my best, but there are apologies for this meeting from colleagues from Education Early Years Directorate, because they're all in the same meeting this morning, which Ray's actually going to afterwards around meeting with head teachers, etc., on some of these issues, I'm sure. So I know if Lindsay was here, he would talk about the work with schools in terms of support around behaviour, education welfare officers, etc., to support schools in terms of the sort of issues that lead to those exclusions. It is an area of concern, not just for our local authority, but for local authorities across Wales, where this increase in permanent and fixed term exclusions has been seen post-pandemic, really, a lot of it related to behavioural issues in terms of children and young people. And I know that the Education Directorate has been looking at good practice across Wales, and they're looking to implement a way of working that relates to that preventative approach with schools, which has been adopted in Newport. So I'm sure that Lindsay and colleagues can provide more details around that. Similarly, in terms of electively home educated children, there was a recent policy that was approved by Cabinet in this area. You know, the statutory duties we have in this area are somewhat limited. We would like them to be more extensive than they are, but there is a visit of at least once a year into those arrangements from the local authority and from colleagues in Lindsay's directorate. Obviously, if there are any safeguarding concerns, they follow the usual safeguarding processes. So, you know, if either those officers in education or anybody else in terms of contact with those children or that family have concerns, they should make those referrals through into MASH, as would be the case for any other child across the county borough. And I've forgotten what the third question was.
The third question was, it states on page 48 that they're going to attempt to reduce access to means of suicide. Could you, I just wanted to clarify what you meant by that, please.
So this is work we've got as a regional safeguarding board, a suicide prevention group. You know, it is an area of concern, you know, both in Bridgend and across South Wales. There are groups that sit beneath that look at the detail in terms of how suspected suicides have been undertaken, and there may be issues in terms of access. It could be to substances, it could be other means of you know, individuals taking their lives, and so looking to restrict access to those sorts of means is part of that whole preventative approach around suicide prevention.
Okay, Councillor Sharon Hopkins.
Yes, sorry, I'll come back with something else later. Thank you.
Okay, thanks. Councillor Richard Williams.
Thank you, Chair. I want to go to page 32 for the first question. It mentions a critical incident, and I was wondering what this was.
Sorry, Councillor Williams, can you hold on for a sec? Sorry. Oh, sorry, Jane. Can you wait, because Richard started, can you wait until after he's, yeah, thanks. Carry on, Councillor Williams.
Thank you, Chair. This critical incident mentioned on page 32, paragraph 3. What was this, and what did we learn from it? That's the first question. I'll go. I've got a couple of others as well, so I'll go through them after.
Should we just deal with that one and then I'll come back to you on the others? Is that okay?
Okay, right on.
So what did we learn from it? Page 32.
Thank you. If I could come in there, Rihanna Granger, Group Manager for MASH IA and Safeguarding. So the critical incident status was called because we were struggling to fulfil some of our statutory duties. We managed that on a sort of immediate and medium-term and long-term basis. What we learnt is that we didn't have sufficient access to live data. So if there were problems in the system, we were finding out too late. So we've overhauled all of our ability to capture live data. So we've got dashboards that tell us exactly the position we're in every single day, every moment. So, and that enables us to also forward plan much more efficiently. So that's certainly the most immediate thing that we learnt that we needed to change. I think is so broad what we learnt, because the way we function now is so different. It's really like night and day. We also learnt about the need to ensure staff welfare is at the forefront of what we do, and that we lead in a compassionate way that looks after our workforce. We learnt the importance of having that permanent workforce also. We also learnt that there was really a lack of consistency in the way practitioners were working. So that takes us on to our science of safety model, and I know everybody here is well versed in, you know, how significantly that has impacted us in terms of the way we work with families, and how that's affected our numbers. So I could probably talk for the rest of today about what we learnt, but I think those are the most immediate snapshots, and it's about having that two-pronged approach to knowing your business and knowing your data, but also knowing your staff and recognising your strengths and looking after those people to enable sufficiency. So I think if I have to restrict it to those two things, I'll restrict it to that.
Yeah. Good. Okay. Thanks for that. Councillor Williams, your next questions.
Right. Well, thank you for that answer. I think that we learned a lot from that. Page 34. There was a spike in numbers of children being made subject to the Child Protection Register at the start of 2023. I was wondering what the reason was for this. Please.
Yes, thank you. If I can come in there. Yeah, so you will see from the data we've had real fluctuations in terms of children on the Child Protection Register. So we had, at around that time, we had an increase of children going onto the Child Protection Register, and we were still seeing the crisis left from the pandemic, all of the social issues and cost of living crisis, but also we weren't removing children from the Child Protection Register in a timely way, and that was a lot to do with having an unstable workforce. Yeah. So in the safeguarding teams where those children sit, there were real staffing issues at that time, thankfully not now, and a lot of turnover. You'll be well aware of the high levels of agency staff that we were using. So with that turnover, it's very challenging to actively work a case. So those children were safe and they were visited, and those statutory requirements were being undertaken. But in terms of that real work to move things on and then evidence sustained change and that those risks were mitigated, that's really challenging. When in a 6-month period, you may have had 2 or 3 changes of worker and you get that start again syndrome. So we did find that children were remaining on the Child Protection Register longer. Now we've got our stable workforce. Now we've got our agreed practice model, and we've got that consistency. Those cases are being appropriately worked. Children are staying on the Child Protection Register for what we would expect to see, the appropriate amount of time. So the amount of time that it takes to really affect change, evidence that change, see it to be sustained, and then to withdraw at a safe time, which is usually around the 9-month figure, which would be the appropriate time for a child to be on the Child Protection Register. If it's longer, you have to ask, is what we're doing working? So so it was a multitude of factors, but not helped at all by the workforce efficiency issues that we were experiencing at that time, which thankfully is not the case today.
Okay, good. Councillor Williams, did you have another question?
Yes, thank you for that comprehensive answer. I wondered actually on page 37, do members of the Social Services Department give talks to children in primary and comprehensive schools about the dangers of getting involved with the county lines, please?
We don't within the Social Services Department, but I know colleagues from South Wales Police do that regularly, that they're often in schools talking about these sort of matters. So that those talks do happen, but it's the appropriate partner who has those conversations with the school-age children.
Okay.
Councillor Williams, okay with that?
Well, one more, please.
Great.
What is the Clear, Hold, Build initiative, please? That's on page 42.
Kirsty, can't see you, but Kirsty.
Good morning, thank you, Councillor. I'm Kirsty Williams. I'm the Community Safety Partnership Manager. Clear, Hold, Build is a strategy that we take forward as a community safety partnership, and one that we're trying in Wildmill at the moment. where involves clearing out some of the problems. So in the case of Wildmill, it would be targeting, you mentioned county lines, organised criminal gangs, drug supply lines. So you're clearing out the problem. You're then holding the community, so working within that community to build up community capacity, working with positive agencies to be positive agents of change there, because we know that when you remove things like an organised crime gang, you create a vacuum. So you're holding them and hopefully creating an environment that prevents a new drug dealer, for example, coming in, and then you're building that community up. So you've taken away the negative impacts, and then you're building up more of those positive reinforcing elements. So working with the community groups. In the case of Wildmill, improving things like access to good quality food supplies, improving trust with agencies like the police, with valleys to coast. So clear, hold, build is a name given to it, an approach where you are clearing out the problem, holding that community up, and then building the resilience levels. I hope that answers the question.
Yeah, thank you very much for that answer. The last question I had has already been asked, I think, so I will thank you, Chair. Okay.
Thanks, Councillor Williams. Councillor Gabby.
Thanks very much, Chair. I thought it was worth making a contribution to Councillor Llewellyn-Hopkins, so I appreciate I'm going backwards slightly. Behavioural issues in schools, we know, is a massive issue. It's causing us an immense amount of pressure within our education workforce. I actually sit on School Social Partnership Forum for the WLGA. It's something that we are raising there as a concern for all Wales. I did meet with Laura Doyle from the National Association of Head Teachers last week. It's something that we're having a joint discussion on because we think it's better that we work in social partnership to try and address some of these issues. And I think it's also worth highlighting that when Welsh Government introduced the ALM bill, the Additional Learning Needs Bill, it was supposed to have been cost neutral. It very certainly isn't. And I can give you all sorts of examples in relation to that, but that's from an all Wales perspective. But that is something that we are continuing to challenge at a WLGA level so that you know as members and can be reassured that it is high on our list of priorities. Councillor Williams, you also referred to our critical incident. One of the things that I would tell you is that we know some of our workforce were very definitely suffering with some vicarious trauma. We do need to ensure that our workforce is fully supported. Social services is not a game that you work in unless you are really passionate about, as a general rule. And we also know that staff can take home issues that they really shouldn't be carrying around with them. So having the appropriate supervision, clinical supervision, and support from therapeutic interventions is enormously important at times. And we were in a very different situation here in Bridgend, as all members are very aware of. I am very grateful to some of those, because we went above and beyond what we needed to provide as the employer's occupational health responsibilities. We went above and beyond that. That's been very supportive. Put my teeth back in. It's ensured that we have staff coming back into work are appropriately supported going forward, and that is an additional element of why our workforce has stabilised. Thanks very much, Chair.
Councillor Haynes, is that a legacy hand or another question? Go on.
Thank you, Chair. I promise it'll be the last one. My question relates to page 40, and it relates to the figures and the analysis of individuals in temporary accommodation. So I note that from between 2021 to 2023, figures more than tripled. And I notice in the report the initiator for this increase was changes in Welsh Government legislation, or legislation from the Welsh Government. My question, and those levels have been maintained since 2023, so appear to be more or less at a permanent, stable state. My question is, given the source of this, and I do understand the further comments, there are other issues at play here, Some of those have been set out on page 41. I understand that, but nevertheless, given that the initial major impact was legislative change, has the Welsh Government followed up with funding for these changes? And if so, is that funding adequate or not? Thank you.
Ian to start and then Claire.
Thanks very much. So in one answer, no, very definitely not. Welsh Government did give us some funding, especially throughout the pandemic. They've been reducing that year on year. It does in no way, shape or form cover the cost of our homelessness provision now that we have to do under new Welsh Government duties. That's the political response. I'm sure that's what you were looking for, Councillor Haynes. So that is something for you to continue lobbying on. Thanks very much.
Not me, Chair. Ryan Jones, who's online, will take this.
Thank you, Claire.
Ryan.
Yeah, thank you, Claire. Thank you, Chair. And thank you, Councillor Haynes, for the question. So Ryan Jones, I'm Commissioner Manager for Housing and Homelessness. I'm not sure I can really give any more detail on what Councillor Gebby said, to be honest with you. The answer is quite clear. No, the funding we get from Welsh Government does not cover the increase in presentations that we're required to make due to legislative change. It was a temporary change referred to as the all-in approach, initially brought in during the pandemic. At that point, we were largely able to recover the costs through a hardship grant, which was available to all local authorities. With the pandemic sort of ending and easing, Welsh Government brought in legislative changes to in essence continue the emergency approach they had taken. They have introduced something called the No One Left Out grant, which in some guises is almost a continuation of the hardship grant, but it's not an unlimited sort of claim back what you're spending, and the grant we get significantly is lower than the spend. I just wanted to note, I suppose, Chair, there is a report going to Subject and Overview Committee 3 in December on housing and homelessness more generally, which will include temporary accommodation.
Thanks, Ryan. I'm on that, so that'll be interesting. Any other more questions? Or do you want to, Llewellyn Hopkins?
Yeah, thank you, Chair. I missed one of my questions, sorry. It's regarding the table on page 35, which shows all the categories of abuse and the age groups. There's it's blindingly obvious from this table that the age group that's subject to most abuse is the 10 to 15-year-olds. And I wanted to know if anything's been done with this group in particular to cut back on this. Thank you.
Hi, thank you. Yes, you're absolutely correct looking at those figures, and that is something that we see year on year, and I think there's a number of sort of factors around that. You know, general challenges with adolescents and young people not wanting to sort of follow household routines and rules, but also within that age bracket we also have our sadly our often exploited children, our children that experience some sort of CSE or county lines, as we've talked about. So we've really taken forward our pathway with exploitation over the last few years, but we don't necessarily do any specific work with that age group. Obviously we work alongside schools and safeguarding leads in schools and community and the police with missing young people, but we don't do anything specific in terms of children's services going into schools, but we have upskilled our staff in relation to recognising some of these challenges for this age group, particularly, as I said, around that exploitation. And now we've got our exploitation groups and our screening tools, and staff are really upskilled now in that area. But yes, it is something we do see year on year with this age group. I suppose it makes sense in lots of ways that we do, given this is the age that young people have more freedoms and have more choice and make their own decisions, and sometimes those decisions are not necessarily what we would want them to make.
Does that answer your question, Joe?
Yes, thank you.
Thanks. I had a couple of points and questions, really. So, in terms of the vacancy situation, I think HR should be here in future to accompany this kind of report, because they have a role to play and I can't see it at the moment. It's something that you do have to nurture because you do want to keep those staff. I appreciate how difficult it is to recruit staff into particularly child and family work. Geographically, Bridgend finds it difficult sitting between Cardiff and Swansea, and that's always been a historical issue. It's great to hear, though, that well-being and the structure is at the forefront of the support. It may not be there in the past for whatever reason, but now that's really good to hear. And also in terms of HR being here, I think education needs to be here, because as we've already heard from the questions and answers, a lot of these issues are dependent on that particular directorate. And Jane, you touched on the issue around ALN and the dearth of guidance and funding to go along with that. And when we are considering as a council, like all councils, cutting educational support services, obviously that falls back on social services and increases their work, just makes it harder, really. Councillor Kebby.
Thanks very much, Chair. I just think it's worth advising members of that. We will have budget discussions coming up. We need to be very clear that if we are cutting some of this early intervention and prevention, whether that's in social services, whether it's in our educational arena, or whether that's in a housing arena, we need to consider the impact that that will have on our residents. And we're trying to do all sorts. We're trying to do all sorts in a much more coordinated way. We need support of members to continue in that vein. And what I would say to all members is we already know from the data that we're seeing through, you know, social services was in a very, very difficult position a few years ago. It's with an enormous amount of work from some very dedicated professionals that we can see those reductions in our numbers. So we need to support that. We are going to go into budget discussions, as I've already said, and one of the first things that we will be doing is looking at what hits our communities. Well, actually, this is an unseen service. It's unseen until you can see the police, or you can see the ambulance services, or you can see children's residential numbers rising again. I do not want, after all that hard work, commitment, dedication of our officers, to go to avail. So, as members, that's something that I will be impressing on you again and again and again, because these services are unseen, but the impact is so detrimental, actually it's life-changing. And you've seen the impact on a case study this morning from one of our members on the previous, from one of our residents on a previous report. That goes across the board. And we're talking about children here. So it's children are our future. Yes, that's the old adage, but actually it's really, really important for future determinations that we make around our budget arrangements. Thanks very much, Chair.
Chair, can I?
Thank you, Councillor Kirby. And Claire?
Yeah. Sorry, I think Rhiannon wants to come in as well, but I just wanted to give some assurance. I know HR aren't here this morning, but you know, we have worked hand in glove with HR over the last 3 years to turn around the situation in terms of where we were from a workforce perspective. So I'm just looking at the figures now. You know, in terms of children's social care, we're down to 12% of the service being agency workforce. We were over 30%. You know, not very long ago, we had over 70 agency workers in children's social work. We're now down to 19. That's the absolute up-to-date figure. That's through us working.
And I think you need to be praised for that as well, to be fair. That's a massive difference.
I have to say we took a lot of learning from other authorities down the road where they've had similar challenges, and you know, you can't do this quickly. You know, the workforce well-being and support and the right management and the right culture is absolutely fundamental to what we've done. You know, growing our own workforce of the future is fundamental. We have successfully recruited international social workers, but you can recruit, but it's how you integrate colleagues into the workforce that makes all of the difference. The right training offer, the right level of caseloads, the right trauma-informed support, as Councillor Gebby has said, and keeping on at that, because it's very, very easy for authorities to slip back from those positions. The same approach really around adult leadership, because we talk a lot about children's, but it's important we don't forget about adults, because you can just as easily slip into those difficult situations. And the right and same approach around our care workforce, as well as around our social workforce. So it has been hard yards, but we are seeing the benefits, and we're seeing the benefits most importantly in terms of outcomes for people and consistency of work for those individuals. But we need to not take our eye off the ball on it, because it would be very, very easy to say, well, we got there, now let's move backwards, and we can't allow that to happen. It will ultimately cost the authority a lot more as well.
Can I just come in there, do you mind, Chair? I'm really echoing, but I think I just really want to make this point. So we've currently got no agency workers in our multi safeguarding hub. We've got none in both of our IA teams, our IRO service. We've got minimal numbers in the safeguarding hubs, but all of those workers have exit plans. Claire talked about the international social workers that we have. And as of last week, all 11 passed their probation period. So there's huge successes across the board in terms of permanent recruitment of really skilled practitioners. And it's really making the difference.
Yeah, thank you, Chair. It's just to backtrack on the answer to my question about the legislative changes around homelessness and the lack of follow-up funding for it. I take Councillor Gebby's response to heart, and I hope that every member of this council, officers and members as well, do make representations to the Welsh Government. This is an important principle, both for the people who are affected by homelessness and for our budget, the impact on our budget. The principle is, if we're asked to do more, the funding must accompany it. It's an incredibly important principle. And if that principle is denied and is not working, then the impact on both the people who need that service and on our budget can be crucial. So I would urge everybody, every member, every officer, every part of this council to continue to make representations to the Welsh Government. Thank you.
Thank you, Councillor Haynes. So if there are no more questions, I'd just like to make one point, and it's similar to the previous presentation, and that is the lack of comparator data. So in future, as councillors, we on scrutiny committees, we like to see where we're at. I'm not asking for a league table, but where we're at in terms of comparisons to other local authorities in Wales, particularly comparable local authorities. It'd be really helpful if we could see some of that data. Yeah. Okay. I just want to say really thanks for the report. I think it is probably the most important responsibility of this council, safeguarding. Yeah. Apart from obviously the welfare of our staff, this is to me the overriding number one responsibility of this council. And I don't think everybody realises that, but when you see some of the information and the data provided, I think it brings you home how stark it is and how important it is. And it's great to see improvements, particularly in the key issue, which is around recruitment and retention, which applies not only to child and family, but also older people as well. So good, thanks very much. So if there are no further questions, thank you to the invitees. You may leave the meeting. again. Item 6, conclusions, recommendations. So we need a summary of the key points, and the committee can then make its conclusions, recommendations. Steve, you going to do this, or?
I am.
Right, great. Thanks. Take it away.
Okay. The committee explored the service user experience. We had some history of the way services have evolved in the local authority, and we learned that continuity in our approach is a key to ongoing support. We also explored the impact that substance misuse has on the range of services and lives and so on within the local authority. I think everybody would agree that it was fascinating to have the service user experience explored in the detail that we had today, and the interaction between that service user and other officers and their professional roles. It was particularly interesting to learn about the role of Buvidal, I think I'm right in saying, and the availability of it, the cost of it, the fact that there's only one producer of it, and that there's a Welsh Government review on in terms of the budget for it in the future, which we understand will report on the 19th of December, or they're hoping to get feedback on the 19th of December. In terms of the residential framework, I've noted that there was a presentation that we could share with members of the committee. It was interesting to note some of the issues, not only around individual needs, but particularly in things like that you wouldn't necessarily think of in terms of pets and so on. That was actually kind of interesting. And the importance then of costs for residential programs, the issues around relapse and aftercare. There was a discussion about Brynawel in Pontyclun. And then also we had a lengthy discussion, but very worthwhile discussion on drugs in prison, and particularly Park Prison, and the way things are organised with the Home Office and G4S, but also, very importantly, how we interact with that service in terms of our role for safeguarding. I've made quite detailed notes about that, and I think they're worth reflecting in the notes, because there is, I think, not a clear understanding about the relationship between the way the prison operates and our specific safeguarding role, and how we interact with that in a multi-agency working group. We also talked about various aspects of data, people presenting for support. I think, Chair, you mentioned about that a lot of the data is derived from people presenting for support, and we wouldn't necessarily know about drug use more widely in the community in those circumstances. It was also interesting to highlight the issue of heroin, but I think this very specific point about female usage of heroin highlighted something that I hadn't realized from the report, that this was the first time this data had been put together in this way, and they would need to explore further some of the issues that it throws up. But very clearly, that one was very important. But it was interesting then, again, to get the issue of that men do not present, and that women do. And that's often a way in which these things are then picked up. And that was the sort of, as it was put to us, the sort of on the street, the idea on the street. So it'll be interesting to see if that is reflected in further research. And then just a few other points. There are obviously 2 new services in development, and we learned something about how those work. And it obviously adds to the very complex environment within which this area operates. And it raises issues about how well it works. Partnership working, very complex. And then stumbling blocks in terms of housing and benefits. We learnt about the lived experience of things that might seem trivial to a lot of people, but which are incredibly important in terms of just accessing bus services, for example, and dealing with the individual prejudices of people you may encounter when you try to use a service. That's obviously a big issue. And the issue about the ambulance service, not sharing data on overdoses to which they're called, and there is an issue there about the information sharing protocol, and they're currently the only service that's missing. And then we learned from Claire, I think, something very interesting, which was about operating at a strategic level, that ring fencing money is key to success often in providing services. And that our APB seemed to work well in the sense that the voice of service users are very strong. So I thought that was an extremely rich report. I think members would agree with that. But obviously, if there are specific recommendations that we can note from members, that would be extremely helpful. Thank you.
Comparative data again.
Yes.
So comparative data for this, Wales and UK, they missed out. Same for safeguarding. Comparative data, Wales, UK. See where we are at, Bridgend. It was a good report, good discussion afterwards. They engaged with the idea that they could speak freely and perhaps raise issues they may not have raised in writing. To be fair to the ambulance service, the issue is about they do need an information sharing protocol in place in order to share. The problem has been it hasn't been signed off, and there's obviously been a delay in that. So questions perhaps need to be asked of the ambulance service. Why is there a delay, and what's the date for that actually occurring? Because it needs to happen sooner rather than later. And I think we asked for a few other bits of information which they agreed to send through. I can't think of anything. Anybody online can think of anything which we could add to this list? Thanks. Do you want to move on to safeguarding? Thanks.
Thank you, Chair. Okay. Well, we started with some very specific aspects of the safeguarding report, the independent audit and care experienced children, to explore whether there were any missed opportunities and the terms of reference, and any other information they can provide will be provided to members. Hopefully Claire will send that through to us, and we'll obviously share it as soon as we can. And then on workforce, which I think was one of the key issues in this report, we talked about levels of non-compliance on the DBS, but it was actually interesting to discover why that is and what the issues are, both in terms of sick leave or maternity, and then the sort of warped statistic about safeguarding, given the kind of training and so on that exists within social services. So there are obviously issues there about PIs and so on, which need to be explored and solved. The report did raise, again, with workforce issues about the front door model. And obviously we've been discussing all year about the introduction of these new operating models, but now we have issues arising in terms of recruitment, in terms of staffing, which may raise questions about how successfully that can operate. But obviously we were given reassurances about that. There are issues about work-related stress, demands, and the complexity of cases that people have had to deal with through this new model. And we were told that there had been redeployments to provide cover, and there was now a formal action plan in place and a project management board to oversee the development of this. We talked about permanent exclusions and what is being done about it, although obviously the issue about education not being represented here today, I think, is an issue worth noting in terms of the way that happened. We talked about additional learning needs and homeschooling, and it was, I think, reassuring to members that the children in those cases are subject to the same safeguarding guidelines as anywhere else. And I think that was useful information. We clarified issues around the access to the means of suicide, and we learned obviously that there are working groups, how suicides are conducted, and then there are attempts to restrict access to the means that have been used. That was interesting. And then we explored the critical incident that happened and why that was the case, and the conclusions that senior staff had reached in terms of knowing your data, knowing your work, and knowing your staff. And I think that was, again, reassuring. We talked about the spike in the Child Protection Register, and it was interesting to learn that that was largely an administrative issue rather than a problem in the community. And in terms of not removing children in a timely way from the register. Then we asked about whether talks were given. The social services team provided talks about county lines and so on, but obviously that is done by the police, and that we work obviously with a range of agencies to ensure that these things happen. And then we talk about initiatives in the community, temporary accommodation, and also highlighting that there would be a homelessness report going to SOC 3 in December, where that issue will be explored further. But it was interesting to discover that this was, in a sense, a product of legislative guidance from the Welsh Government without the associated funding. So hopefully that will be picked up in SOC 3 for further exploration. Then obviously we talked about abuse and age groups, and particularly the 10 to 15 age groups and the biggest challenges that they face in that respect. And then obviously there's the vacancies issue. In adult care, yes. And related to that, again, highlighting the need for HR and education to be at future meetings when this issue is discussed. We'll make a note of that. But in the sense, there was reassurance in there's been a very strong move away from agency staff, and that we're seeing benefits in that regard in terms of outcomes for residents. And Claire stressed, I think, very importantly, that it's very easy to go backwards in these situations. But there was reassurance in terms of the recruitment of international social workers seems to have been a success. So all 11 have passed their probation, and that's of huge benefit to the local authority. And then again, just to highlight the lack of comparative data in the reports, particularly what's going on in other local authorities. It would be very handy to have that in all reports that we get, frankly. But yeah, but thank you.
Steve. Okay, so next item then is item 7, forward work programme. Steve, is that you again, or? Great.
Okay, so the forward work programme. Following on from members' consideration at previous meetings, the forward work programme for this committee is attached as Appendix A. The subject overview and committee's forward work programme will be included in the next report to Corporate Overview and Scrutiny Committee, with an update from each SOC meeting included. The updated recommendations monitoring action sheet is attached at Appendix B, which tracks responses to the committee's recommendations at previous meetings. I'll hand back to you, Chair, for any questions from members. Thank you.
Thank you, Stephen. Any questions? No questions? Okay. So in terms of the previous responses, we had detail about that as well, so I was okay with that. So just moving on then to The next meeting, which is on the 17th of January, we got the draft MTS, which would be interesting. Assisted transport policy consultation. And then we've got in March, library cultural services. I wonder if we can have some clarification around that. Library and cultural services, is that RWEN or is it less than RWEN, more than RWEN? I know there's a pre-decision required about that, but it'd be helpful if the parameters of that discussion, what that's about.
Yes, it's largely about RWEN, but it's been left broad for members to inform what the report should be about. But obviously there's also a link with Governance and Audit Committee and the request there for a scrutiny committee to look at RWEN.
Right.
And that is the opportunity for a scrutiny committee to do that.
Okay, so for members then, it's up to us to be specific about what we're expecting from that presentation, report and discussion.
Yes, I mean, the more input we get from members, the better. Yeah.
Right. And it relates to governance and audit as well.
Well, a request came, but it was already on the agenda. So in terms of governance and audit committee, we'll report back that it's already on the agenda of a scrutiny committee.
Right. So it's our responsibility to do something about that. And then a big one coming up then in May regarding the topic of the elimination of private profit from the care looked after children, which is a Welsh Government initiative, which is going to have massive implications for all local authorities, but particularly Bridgend in terms of our children we have to place out the county, as we call it, in another with another residential provider, and the huge costs involved in that. And there's a workshop on the 5th of December at 3 o'clock for that. So we urge all members to attend. And there's another briefing then on the 7th of January at 3 o'clock, 10th of January at 10 a.m. Accommodation-based service review, briefing on the 10th of January again, same day. Okay. Any additions from people online about those issues raised? No, nobody in the chamber either. Okay, so item 8, urgent items. There are no urgent items of business in respect to which notice has been given in accordance with Part 4 Council Procedure Rules. So I'm now going to bring this meeting to a close. Thank you very much for attending.